Fox 5 and Hot 97 present Street Soldiers with Lisa Evers.
Hi, I'm Lisa Evers. It's great to be with you again on a Friday night right here on Fox 5. Street Soldiers is back, but of course with all the social distancing and safety measures that are part of this new normal none of us ever asked for. We've been on an emotional roller coaster these last couple of months as the coronavirus pandemic turned our world upside down. Changes come fast to our lives whether we were ready for it or not. Thousands have died, and many more thousands of our healthcare, frontline, and essential workers have been risking their lives to move us past this crisis. Some have paid the ultimate sacrifice. We will always honor their memory. Most of all, to the family members and loved ones of the thousands of lives we've lost to the coronavirus, our deepest condolences. Hip-hop had its own loss. Bronx-born rapper Fred the Godson passed away after a 3-week battle with coronavirus. Our thoughts and prayers go out to his family, friends, and fans. Over the next half hour, we're going to check in with some of our all-star panelists, including longtime friend of the show, Ja Rule. He's going to tell us what he's doing to help healthcare workers on the front lines, and also why he thinks he had the coronavirus long before the lockdown. But first, let's start with Bronx Borough President Ruben Diaz Jr.
When you look at per capita, we the borough that's been the hardest hit, not only in the city of New York, but of all the 62 counties in the state of New York. And you know that New York State is where the storm of the pandemic is. Therefore, that makes us right at the eye of the storm. And when you look at, of course, the health, the amount of deaths, but then other things that come with this pandemic, food shortages, you have food, you have food anxieties, you have people who have lost their jobs. And so it's been really tough on us.
Ruben, tell us about what's being done to help people, particularly in NYCHA, through this Ready Responders program.
Well, even during better days, you know that NYCHA has been one of our communities and population, not only in the Bronx and the city of New York, that's always shortchanged, that really needs a lot of attention. And during this pandemic, we saw that a lot of the men and women who live in NYCHA were being undercounted. And so one of the things that we were able to do is convince the governor and work with the governor and other elected officials with a healthcare organization, a network that's called Ready Responders. And we have a pilot program in the Bronx and throughout the city of New York. In the Bronx, we are starting in High Bridge, Eden Wall, and Jackson houses. And essentially what this is that you have telemedicine for those who are living in those developments. You also have home visits. You have COVID-19 testing, but they are also making sure that you get the medical attention on issues that have nothing to do with coronavirus. This is at zero cost to the city, zero cost to the state. It's Medicaid, Medicare, and if you have health insurance. But if you don't, Lisa, no one is being turned away here. So we want people to take advantage of this. Telephone number for those people who live in those developments who are looking to benefit from these services is 1-888-727-7014.
Dr. Fambu, why do you think we're seeing such a big racial disparity in the coronavirus cases and the deaths?
Historically, I mean, we've known that minorities, especially African Americans and Hispanics, have had difficulty accessing healthcare. That's one. The second piece of this is we have, and as a community, there are a lot of comorbid conditions that exist, right? Taking a place, for example, like the Bronx, where we have high rates of asthma. If you look at the hospital readmission rates for asthma within the Bronx, it's significantly high. If you look at cases of diabetes and cardiovascular disease, those are significantly high as well within our community. And so I think that set up the perfect storm for when you have something like COVID-19 affecting our community, and you see a lot of people with these comorbid conditions actually dying from this. So that is a very big problem.
What about in terms of lifestyle? What effects does that have on who's susceptible to the coronavirus?
So in terms of lifestyle, we do know that, when the virus started spreading, we talked about the idea of stay at home, right? We have this nationwide and citywide stay at home orders, but We also know that those essential workers, a lot of people that are essential workers, people that work in grocery stores, the home health aides, right, nursing assistants, nurses, the food delivery people. All these people, not all of them, but majority of them come from, the minority community. And so these people still have to go to work, right? So even though other people have the opportunity to maybe have second homes or have the opportunity to leave the city, most people can't. So these people are stuck within the city and they have to travel to work, and they're still going to work during this particular process. And to compound to that problem, a lot of these people depend on public transportation. So you have a lot of people taking the trains and the buses to go to work, which puts them in close contact with other people. And then when they work and they go back home, a lot of the times people live in very crowded quarters, and so that's a perfect area, for spread of this particular disease.
Dr. Manny says this is a good time to utilize new technologies to provide quality health care for everyone. We have a lot more still to come. We'll check in with hip-hop superstar Ja Rule and get good advice about your legal rights and your mental health. During the pandemic, we've been keeping our Hot 97 radio show going every Sunday, and in some cases on Saturdays as well. Back in April, we checked in with longtime friend of the show, hip-hop superstar Ja Rule. Let's see if we have him right now. Rule, are you there?
Hey, it was Lisa. What's going on? How you feeling?
All right, how are you feeling?
I'm great right now. I'm up in my office. I'm working, so all good.
I see that. Now normally you would be about to get on a plane from someplace you performed at the night before, and we would never.
Yeah, right.
It's a whole different thing now, right?
Yeah, no, actually, it's a Sunday, so I'll probably be headed home today. On Sundays, I try to make it home to the family and do the Sunday family thing. So.
Which is a great thing. That's why I stayed married for 19 years.
Yeah, right.
So yeah, congratulations.
That's like 100 years in hip hop, right? It's like dog years.
Congratulations to you and your wife. She's always been by your side, and we love her.
That's my rock. That's my rock. I appreciate it. I'll let her know, Lisa. I'll tell her.
Yeah, tell her. No, we love it. But Ja Rule, everyone knows you, of course, hip hop star, businessman, philanthropist, and. You were with us. We were talking. The caller that we had, the end of the last hour, was a NYCHA worker, which you've been with us on the fight with NYCHA for the last couple of years as well. But you've been doing some things, and the reason I wanted to talk with you now was because, this coronavirus thing is really hitting our communities very, very hard, and you've been doing some great stuff. So I wanted you to just tell people about what you've been doing and how you got involved in it.
Well, my guy David. Prince that works with me with my company Icon, he approached me about doing something with Not Give a Sock and giving away some of my masks to the homeless. And I thought that was an amazing thing, an angle to take, because everybody's been doing what they can, and everything's been kind of geared at the essential workers and stuff, which they need it the most. Don't get me wrong, but the ones that get forgotten about a lot, often, almost all the time, are the homeless. And
right.
they don't have a home to go to and stay home and quarantine and shelter in place and all this stuff. So, I thought that was a great thing. So I donated 2,000 of my masks, over 2,000 masks to Not Give a Sock and the homeless shelters here in New York City. And then I seen something on Instagram, and a friend of mine, Scott LaRock Jr. I know you know Scott.
Yep.
Scott LaRock Jr.
Scott.
He hit me up. Yeah, he hit me up, and was talking about the hospital right here in Lincoln Hospital in the Bronx. And they were picketing and protesting, about not having the right equipment to work. And I was like, this is a disaster. If we lose the people who we need the most to save us, to help us, this thing could spiral out of control very, very fast. So, Scott hit me up about donating some of my masks to them. So I was like, yeah, man, sure, of course. And so I took another 1,000 out to them. And now the funny thing about that is that after I did that, my mom seen it. She seen it on my Instagram feed, and she hit me. She's like, boy, I was born in that hospital. That's my hospital, Lincoln Hospital. I said, get out of here, Ma.
Did she really? Shout out to Mom's Rule.
Yeah, shout out to Ma Dukes, man.
My
Lincoln
Dukes, shout out to
Hospital,
My
man.
Dukes. But Rule, when you look at how much things have changed right now, because even, I mean, I was just, I sent Dr. Manny the NYCHA town hall that we did, that first one with you in January 2018. And it's just, you were so great to come out there because a lot of people weren't speaking out then. And, to support the residents. And also to, you stayed for so long afterwards, everyone putting their arms around you, taking selfies. And it's just like, we can't do that right now. We can't be like with the people like that,
Can't do that. It's so crazy because I actually think I had COVID. And this is crazy because when I came home from Super Bowl in February, I was sick. Like, I mean, super sick. I had 102 fever. It was the sickest I've ever been. So I went to I thought it was just a regular cold, maybe starting to catch a pneumonia or something on the verge of that or whatever. So I went to the doctor once I got home, but I was getting better. My symptoms were starting to pass. And then I went to the doctor anyway because a friend of mine called me and said, listen, you should go because I went to the doctor and I was diagnosed with the flu and bronchitis. So I said, all right, you know what, let me go because I was around him and he was coughing all over the place. I said, you know what, let me go. So I went and they diagnosed me with bronchitis and gave me an asthma pump. Now, I ain't never had no goddamn asthma pump. They gave me steroids, antibiotics, and they gave me the asthma pump thing, which I think was a Buterol in the asthma pump.
Correct.
So I've never had any of these things. So now I take them, I use them or whatever. I got better, but it was the worst time. It was the worst I've ever been. And then the whole, COVID news comes out, weeks later that it's running rampant through the country. And I'm like, damn, I may have had it and not even realized it. A lot of people got sick of Super Bowl.
We're joined right now by Phillip Hamilton. He's a criminal defense and civil rights attorney. He was formerly with the Bronx Defenders. Phil, thanks so much for being with us. We appreciate it.
Lisa, thank you for having me as always.
What kind of changes have you seen in terms of the legal system since this whole coronavirus pandemic began?
Lisa, what I've seen at this point is basically almost a complete and total shutdown. Things are just right now at a standstill. We don't really have any court hearings going on. Appearances, for the most part, are limited to virtual appearances. Some of the court parts are open for emergency hearings, both in criminal and civil court, but even those are really limited. And even though sometimes you still may be going into court without a judge, things are just slow. They're at a standstill, and we're just waiting to see what's going to happen.
And then in terms of people being approached by police because of the social distancing orders and these dispersal type of situations that are happening, the mayor reached out to the public and asked people to call 311 or text a certain number if they see too many people, gathering in one place. What would you recommend for people to do? Because there's been some questions and confusion about that.
I mean, the first thing I recommend for people to do is just, if you don't have to be outside, just don't be outside, both for, your health reasons, but then also for the legal reasons. Because, to the extent, if officers are coming up and ultimately saying that you're not following the social distancing guidelines, or they feel as though you're in any way, a threat to the public health, they have every right to issue you a summons. Those summonses at this point have maximum fines anywhere up to $1,000, as Governor Cuomo has allowed for them to be. We also have situations where, to the extent that people are getting frustrated with getting the summonses, you definitely don't want to start talking back to the police or getting irritated in that respect, because then you can get arrested. And what I can tell you right now, Lisa, is the last place you want to be in New York City at this point is in jail.
Absolutely. Absolutely. Because a lot of coronavirus cases, and in fact, they don't even know the real numbers.
Absolutely. I mean, those things right now are just kind of like a boiling pot and just a festering house for the coronavirus, be it Rikers, be it the boat, any of the facilities within the city. You just don't want to be there. So to the extent if the officers are asking you to do something, just comply with social distancing, regulations, and just, try to stay inside to the extent that you can.
How concerned are you about the number of summonses that's being issued? There are a lot of summonses being issued, and, some people may be like, well, I don't have the money to pay this right now. I can't deal with this right now. I've got so many other things going on. What are the consequences with these summonses that you're concerned about?
I mean, the consequences are the monetary hit that you would take. You know, to the extent if you end up getting fined $500 or $750, moving forward into an economy that, Lisa, we don't know what it's going to look like on the other side of this. You don't want to be in a situation where you're saddled with debt, or let's even be more frank, where you're forced to have to come to court to answer the summons. Even if you're not going to go to jail, like we said, coming outside at this point is just something you don't want to do. So, you know, that definitely concerns me, because it's putting an obligation on people to maybe have to come outside and or spend money that they don't have.
I'm joined now by Dr. Jeff Gardere. He's a clinical psychologist. He's also a professor at Touro College of Osteopathic Medicine. Dr. Jeff, thanks so much for being with us on Street Soldiers again.
It's a pleasure to be with you, Lisa. Thank you.
What effect do you see this pandemic having on people's mental health?
Well, I see that people really are dealing with a lot of emotional ups and downs, a lot of anxiety, a lot of depression, acute stress disorder, PTSD, with having nightmares and having sleep disturbance and having intrusive thoughts and flashbacks and so on. People are really up in the air because they don't know what to think. This new reality of ours, Lisa, really has blown our minds because we've never experienced anything like this in our modern history.
Now, you talk about the uncertainty that is in so many aspects, even just down to the most basic daily thing that we all do, as setting off this fight or flight kind of thing in us. What do you mean by that?
Well, when we're dealing with stress, any kind of situation that we deem to be dangerous, we go into fight and flight mode. And basically what we see, several hormones, neurotransmitters are released, such as adrenaline, for example. We talk about that boost of adrenaline, and it gives us the power, the strength to either be able to stay and fight whatever the enemy is, or to run away and to fight another day. And so with this invisible enemy, COVID-19, we are stuck in a fight and flight mode. And if you don't turn off those neurotransmitters, if you don't turn off those hormones, if you don't turn off the adrenaline, it begins to wear the body down, not just physically, but also psychologically too.
And how do people turn that off or turn down the volume of that?
I like that term, turn down the volume, and that's what we need to do. The volume of that stress and the volume of the intensity in our lives. I think one of the most important things we can do is to look at a way that we can separate ourselves from this continuous stimulus or stimuli that we have. So that may mean retreating into a particular room and not putting on the news. It may mean breathing. It may mean meditating. It may mean praying. It may mean just spending the time with our families and not having to bombard ourselves with what is going on with COVID-19, but be more interested as to how we may be surviving in a positive way through this one of the most dangerous times in our modern history again.
But how do we frame our reality? Because you can get yourself in a good mood when you're inside your house or your apartment, and then you go outside and there's reminders. Everybody's wearing the mask. Everybody's kind of walking around like this, trying to stay away from people. And then how do you keep a positive mindset when, I got to wipe this down. I got to have these gloves on. I have to be all these little things that we have to do just to do basic chores.
Well, first of all, we need to be aware that so many people have died of COVID-19. So many people have died of other health complications and couldn't get help because the hospitals were full, that so many people have gotten sick. The poor, minorities, underrepresented minorities have suffered even more. So we are very lucky to be able to be in our homes. We are very lucky to be able to connect with others and to have family. So what I'm talking about here is counting our blessings, the fact that we are surviving every day, that we are adapting every day. We have to keep a positive mindset that as each day passes, we become stronger and stronger. And there's going to be, as a scientist, really believe other waves of this COVID-19 or other COVID-related diseases. So we have to really forge ourselves in a way that we're able to, as we learn from each and every day, how to become stronger for the days that will follow. We will make it through this, but it really is about how do we connect with other people so we support one another through this. And that, I think, is where our real strength is.
Before we go, I'd like to say thank you on behalf of my entire Street Soldiers team to all of our frontline, essential, and healthcare workers, and to everyone doing their part to help move us forward to a better place. We're so glad you could join us. I'm Lisa Evers. Remember, use your mind as your best weapon. Let's push for peace, love, and health for everyone.